Hello and welcome to this in-depth look at Helicobacter pylori, commonly known as H. pylori. This bacterium is responsible for various gastrointestinal diseases, including gastritis, peptic ulcers, and even stomach cancer. In this video, we'll cover everything you need to know about H. pylori, its causes, symptoms, diagnosis, treatment, and complications. So, let's dive in! H. pylori is a gram-negative, spiral-shaped bacterium that colonizes the human stomach lining. It was discovered in 1983 by Australian scientists Barry Marshall and Robin Warren, who proved that this bacterium is a major cause of peptic ulcers. H. pylori is unique because it can survive in the harsh, acidic environment of the stomach by producing an enzyme called urease, which neutralizes stomach acid. H. pylori is primarily spread through oral-to-oral transmission, such as sharing utensils or kissing, fecal-to-oral transmission like contaminated food and water, poor hygiene and crowded living conditions. It is more common in developing countries due to inadequate sanitation and lower standards of food hygiene. Many people infected with H. pylori do not experience symptoms. However, when symptoms do occur, they can include abdominal pain or a burning sensation, bloating, nausea and vomiting, loss of appetite, frequent burping, unintentional weight loss, dark or tarry stools, which may indicate gastrointestinal bleeding. Once H. pylori enters the stomach, it adheres to the stomach lining and weakens the protective mucus layer. This makes the stomach more susceptible to damage from stomach acid, leading to inflammation and ulcer formation. Over time, this damage can result in more severe complications. If your doctor suspects H. pylori infection, they may recommend the following tests. Urea breath test. You drink a special liquid containing urea, and if H. pylori is present, it breaks down the urea, releasing carbon dioxide, which can be detected in your breath. Stool antigen test. Detects H. pylori proteins in a stool sample. Blood test. Detects antibodies against H. pylori, although it's not useful for detecting active infections. Endoscopy with biopsy. A small sample of stomach tissue is taken and examined for H. pylori. Treatment typically involves a combination of medications known as triple or quadruple therapy. Triple therapy includes a proton pump inhibitor such as omeprazole and two antibiotics like amoxicillin and clarithromycin. Quadruple therapy, used if resistance is present, includes a proton pump inhibitor, bismuth subsalicylate, metronidazole, and tetracycline. Treatment usually lasts 10 to 14 days, and adherence is crucial to prevent antibiotic resistance. If left untreated, H. pylori infection can lead to severe complications, including peptic ulcers. H. pylori is the most common cause of stomach and duodenal ulcers. Symptoms include sharp stomach pain, nausea, and vomiting. Ulcers can lead to internal bleeding, perforation, and obstruction of the digestive tract. Gastritis. Chronic inflammation of the stomach lining can lead to pain, nausea, and discomfort. Gastric cancer. Long-term infection with H. pylori increases the risk of stomach cancer by causing chronic inflammation and genetic changes in stomach cells. Symptoms include unexplained weight loss, persistent pain, and difficulty swallowing. MALT lymphoma. H. pylori can cause a rare type of stomach cancer called mucosa-associated lymphoid tissue lymphoma, which affects the immune cells in the stomach lining. Iron deficiency anemia. H. pylori infection can impair iron absorption, leading to chronic anemia. Vitamin B12 deficiency. Chronic H. pylori infection can interfere with vitamin B12 absorption, causing fatigue, weakness, and neurological symptoms. While there is no vaccine for H. pylori, you can reduce your risk by practicing good hygiene, like washing your hands regularly, drinking clean and safe water, avoiding contaminated food, and using separate utensils while maintaining good sanitation. Scientists are researching new treatments, including vaccines and alternative therapies like probiotics, to reduce antibiotic resistance and improve eradication rates. H. pylori infection is a common but serious condition that can lead to ulcers, gastritis, and even cancer. Early detection and treatment are key to preventing complications. If you experience persistent digestive issues, consult your doctor for testing and treatment. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more health-related content.